Hello, I'm in Liverpool city centre on this chilly Wednesday afternoon, but it's a nice afternoon, a lot going on, really busy today. More and more reports are coming into me. A good friend there, he's in Alder hospital as I speak with his grandson, and he's telling me about the hospital now is just literally bursting. Most, not all of the beds are taken up by new arrivals, and he spoke about what I'd previously said about the law of supply and demand, the iron law of supply and demand. You can't cheat it, you can't beat it. The demand is inexhaustible, the supply is limited, and once you get to a stage where the supply can't keep up with the demand, then that's when you have problems, and that's now happening. We're seeing nursing staff across Liverpool on strike. It's about time the union leaders come to terms with the effects of mass immigration on the NHS. They're silent on it, but even if they remain silent on it, eventually the problems are going to arise where no one's going to be able to ignore them at all, and that's what's happening now. My good friend, I hope your grandson's okay, sir, in Alder Hospital, and this will probably be happening right across other services, schools, doctors, dentists, hospitals, children's hospitals, the whole lot, like I've previously said before. And it's, as I've said, once the supply can't keep up with the demand, then problems, big problems, and this is now what's happening in our city. And it's time now to close the gate. No more coming in. There is too many coming in. Right, local services, they can't keep up. They can't maintain the deluge of new arrivals entering into the city. The services just cannot cope. Alder Hospital is a classic example of what is now happening. Anyway, I'll get back and enjoy the rest of the day. It's a real busy, lively Wednesday afternoon. Okay, thank you. Hello, I'd just like to further add that this state of affairs is totally unacceptable. It's not only putting the health and welfare of local children at risk, but also new arrivals who arrive here. Their children are still children, and no one would want to deny them health care. But if this situation continues, then kids' welfare, well-being, even lives could be put at risk. Of course they could, because if there's not enough beds, there's not enough nurses, the supply can't meet the demand, you're going to have problems. So the union leaders, the NHS union leaders, need now to lobby the government, pressurise the government in at least trying to cut back the amount of new arrivals that are heading into our city, into our country, because if they don't, they're complicit in the problems that are now going to be building up in this country. Services, hospitals, doctors, dentists, all the usual ones. We're now seeing it, like I've said, in Alder Hospital, right? And that is totally unacceptable. Bursting at the seams, most, not all the beds, new arrivals, when there's local kids here who obviously need beds. And like I've said, no one wants to see anyone go without healthcare, but someone has to be put first, and that's the good people of this city who've paid into this city decades, hundreds of years, right? We just can't, okay, no one's saying neglect anyone. That would be the last person to say that, but there has to be a time when we call, well, time is called on this. You'd have to excuse me, it's very busy. If I get a bit tongue-tied, it's not that easy sometimes. But anyway, bear with me. So it's up to the union leaders now to lobby the government and say there's too many. We can't cope, we can't keep up, and children's lives are going to be put at risk here in Alder Hospital, just as one example. And there's other services as well. I hope I made that clear. As I say, it's a very busy day, and sometimes it's not that easy trying to get your message across. As I say, there's an awful lot of people here in the city, an awful lot of new arrivals as well. Okay, thank you.